efficiency programs, and other related subject matter. This meeting is recorded so that we can share it with the meeting along with the presentations and minutes to those partners who are unable to join us today. The follow-up email with all corresponding documents and links will be sent in 1 week. At this time, we do ask that you introduce yourself in chat. Please include your name, pronouns, organization, and role. This is helpful to partners for connection purposes, helpful to us as well. So I'm going to go ahead and do that myself. So for today's meeting, we have follow-up on a couple of conversations we had earlier this year. Up first, we will have Tina Gorn from Family Support and Connections Program to do follow-up on a presentation we had a few months back and answer questions and just kind of give some reminders, I think, about the program. And then we also have a discussion on the COFA eligibility communication. So a few months back, we talked about how best to communicate to our COFA communities. And there was a request that we check in on how all that went. So that's going to be the second part of our meeting today. So up first, we have the follow-up presentation on family support and connections. It looks like we have the PowerPoint up and ready to go. Tina, are you ready?
Yeah, thanks, Misha.
Uh-huh.
Hi, everyone. I'm Tina Gorin. As Misha said, I'm the lead coordinator for Family Support and Connections, and we had a presentation earlier in the year, so this might be a bit repetitive from then, but just giving a general overview of the program for y'all. You can go ahead and move into the next slide. We'll talk about what is Family Support and Connections, which it's a program of free voluntary home visiting through contracted community-based organizations for services that can help families with the challenges of parenting, financial stressors, and other common struggles that families may experience. Our services are designed to reduce stress and strengthen family protective factors, including families' understanding of child development and parenting, access to goods and services, ability to manage challenges in life, connection to both informal and formal social supports, quality time and bonding between parents and children, and their capacity to foster nurturing interactions with their children. Services are available to families with children 18 or younger in their home that meet income requirements, which we define as under 300% of the federal poverty level, and that are not actively receiving services through child welfare. Family advocates meet with families at time and a location that works best for the family, and they partner with the family to identify and build upon their strengths to help reach goals. So this is through strength-based needs assessments that work to identify the strengths and the needs as the families see them, family plans that are tailored and individualized to meet their unique needs, connection to resources through home and community visiting, parenting supports, flexible funding for short-term immediate needs, and really facilitating a wraparound approach. So if a family is working with other service providers, when permitted to do so, family advocates are also collaborating with those providers. That approach really helps to reduce duplication and is intended to serve as a well-connected support system for the family. So we can go ahead and move into the next slide and also say if there's any questions or comments coming in through the chat, I'll be able to answer those at the end and make sure that we have time for coming off mute for questions as well. So as mentioned, Family Support and Connections home visiting services is through contracted community-based organizations. So the services are available in all counties in Oregon. You're likely familiar with many of the providers that you see displayed on the slide there. These are all community-based organizations that offer various other programming, such as like addiction resources, mental health services, maybe other home visiting programs, parenting classes, and housing and utility assistance. You go ahead and move into the next slide. Why might you consider Family Support and Connections? Well, we seek to provide support for families with unmet needs earlier before higher levels of intervention, such as child welfare, may be needed. Many of the families referred to services experience challenges related to substance use, mental health, domestic violence, homelessness or risk of homelessness, disabilities, special needs, caregiving demands, lack of social support, or maybe some other various unmet needs. In the next slide, we talk about how you can access services through the Family Support and Connections webpage. Easy URL to remember is familysupport.oregon.gov. Both community and self-referrals can be made by selecting request services at the top of the webpage. We have that outlined on the slide there with that blue arrow. Minimal information is required to make the referral and should take really less than 5 minutes to complete. Referrants can select which preferred provider in an area. There's multiple options available. We have a few districts that have 2 or 3 different providers. And then the contracted providers will typically connect with the family within 2 business days of receiving a referral. And then kind of depending on the family's preference as well as the provider's availability, the first appointment is generally scheduled within a week. And our next slide is just kind of showcasing what participants that have received services through Family Support and Connections say about their experience. And I won't read through each of them, but I'll leave you with that really consistently over many years through these family satisfaction surveys. We've noted an overarching theme of participants sharing their appreciation for the non-judgmental support from their family advocate who's listening and really helping them feel less alone. It's a big takeaway of what folks experience with these services. And then in the next slide is a way to contact us. If you're interested in being connected with a local service provider in your area to present or provide materials, you can reach out to us and we can help make that connection. Yeah, otherwise the FSMC Central email address there is how you reach us directly. I'll pause there and see about any questions.
Tina, can you share the website just one more time?
Yeah, I'll go ahead and put that in the chat as well. And then I understand that, yep, this will be sent out as well. So you'll have the slide deck and all of these links.
Thank you.
Also point out on the webpage there, I think what we're seeing right now, there is a new button there with a very short video, like a minute or less video that also helps describe the program and is an easy way to sort of understand that in less than a minute.
So I know a few months ago when we had this presentation, there was lots of questions, and it was a new program for many folks who are on the call who were really curious about it and kind of wanted to know more. And so I just wanted to make sure that well, to kind of check in. Some of you may have heard the presentation before. It might be new for others. If you have some questions there. Maybe if you've had the opportunity to talk to some of the folks you're working with about the program, because there was a lot of interest at our previous meeting. If there were questions that came up that you'd like to talk about or any experiences that you've had, would be great to share.
And Misha, the invitation remains open. That contact information is how to reach us separately if that's a better forum for reaching out with questions as well. Love to hear from you.
All right, thank you, Tina. Well, do check out that website. There's lots of great information there. Heather, did you have something?
Yeah, I
saw you
just wanted to
popped on.
say I worked in previous roles. I worked for child welfare and I worked in self-sufficiency doing direct work with staff and the individuals that came to us. And Family Support and Connections was always such a wonderful opportunity to get into the homes. The level of stability that we saw and just the support that those parents received was a real game changer for many of the families that I was working to support. I cannot recommend this program enough. It really is wonderful. That's it. Just yay, Family Support and Connections. And hi, Tina.
Thank you, Heather. All right. Well, if something comes up a little bit later and you would like to ask a question at a later time, please know that you are welcome to do so. Absolutely. All right. Well, we are moving on to the discussion part a little bit early today, but that's okay. We'll open it up and maybe even have some more discussions today. Um, so a few months ago, there was a request that we revisited how communications around COFA went. And so I'm going to hand it over to James to lead that discussion with anybody who would like to
Yeah,
participate in
hello
that.
everyone. Yeah, James Barta, he, him, and I'm here to talk a bit about something that came up back in September. So just to remind everyone that, early September, we finished the build into the one system so that people with COFA status were now eligible for SNAP. Now, just as a reminder, COFA means Compacts of Free Association, which is a completely non-descriptive acronym to describe, not describing what we're really talking about, which is these compacts that the United States has with the Federated States of Micronesia, the Republic of the Marshall Islands, and the Republic of Palau. And these people, we did a lot of things to their areas, and as part of the relationship we now have with them, they can come to the US, and I'm not a legal expert, but they can do various things. And one of the things that has been long overdue was having them be eligible for SNAP. And so that finally happened this past, during this calendar year. And so we were able to successfully add these people here in Oregon, if they're income eligible and all that, to the SNAP rolls. And so, as Misha mentioned, this is a topic that we wanted to come back to. Now, we were hoping to get, to organize something, and it just, didn't happen. But nonetheless, the main goal we were hoping to have is some time to hear, how did things go? Do any of you work with this population? Did people get the notice about COFA eligibility for SNAP, and how could the rollout have been better? And while you're thinking about these questions, I'm going to drop in the chat some of the messaging, the flyers that were created to help us get the word out about this eligibility. Each of these flyers, and they're different language, have English as well. But if you scroll down, you'll see the other language. And so this is where I throw it open. Since things pop in my head, I'll mention one other thing. I wanted to thank, even though she couldn't be here today, Jackie Leong, who gave an introduction for us back in September about these individuals and their legal status in more detail than I am able to right now. But nonetheless, is this something? And Beth, I see you have, I am, your question, has there been an uptick in SNAP since COFA folks have been eligible? I don't think, not that I've dug into the numbers, but I can't say that we've seen that. There's been so much change with the medical redeterminations winding up that I think that's been capturing our attention within OEP. But I also have to admit, I didn't dig into the data in preparation for this meeting as I should have. Do you have something else, Beth? Oh, okay.
Maybe that's something we can look into a little bit, James.
Yeah,
I
absolutely.
know I did check in with Mayora, one of our SNAP program manager, and because she wasn't able to make it today, and she didn't have an update on this particular subject, nothing to share or feedback that had come her way, but we could ask there as well.
Go ahead, Beth.
Oh, sorry. Thanks, James. I just thought I'd throw it out there. I do not have any information to share, but I would love to hear from anybody who's attending this meeting, either now or like at subsequent meetings, if they have heard anything in terms of what barriers that still exist to COFA folks getting SNAP, either application or information or just like uncertainty about immigration statuses. It would be really, I'd be really interested and might be helpful. Maybe we could focus advocacy efforts if we knew that there are barriers. Maybe there aren't any barriers and everybody who's eligible has been signing up, but I don't know.
Beth, that is an excellent point, and I want to come back to that because that's sort of a larger topic, a larger question. But before I do that, Linda has a question in the chat about if the benefits are basically the sliding scale is the same as any other U.S. citizen. And my understanding is yes, it's just they are now eligible for SNAP just like anyone else. So there's no difference between a person with COFA status and anyone else. It's a U.S. citizen. Does that answer your question? Did I understand that right, Linda?
Sorry, I'm just gonna stop with the typing, just because I had my toddler next to me, so you wouldn't be hearing me. But yeah. According to the first question that I asked, yes, I was just calling. I just wanted to know if the ODHS is going by sliding scale or like by income, like any other normal U.S. citizens that are qualified, and if so, like because I had a couple of families that called in regards to their benefits that they did get qualified, but they were receiving only about $10. So they weren't too sure if that was the prorated amount that they receive upon their qualification or their determination of getting the benefits, or is that something that it's yeah, so that these are the questions that I'm getting from our community. And then my other one, Beth, I know you mentioned about barriers. Yes, if these application, can they be translated into the Marshallese language, or are we in process of that? Do you know if that could be something that we can get the applications translated into the Marshallese language?
Okay, well, first of all, the one application itself is only in English and Spanish. So the online application, it's a big lift. We're hopefully going to do Russian in the next couple of years, but that's a little ways out. As for a paper application, that's a great question, and I don't have the answer. So we can see if we can get that rolling, but I can't make any promises as I sit here. So sorry for that unsatisfying answer. Yeah, Beth.
Thanks, James. I just a couple of thoughts. First of all, for Linda, I don't know that this is like an officially sanctioned tool, but there is a SNAP calculator online that we sometimes use at Legal Aid and Oregon Law Center to just like get a back of the napkin. Is this right that they're only getting $10? You put in the income and the family size and a few other things. So that might be a tool to help just, assess whether there's something going wrong and the person needs to, contact the office. That the other thing is we regularly encourage people when they have a question to call their local self-sufficiency office, request an interpreter, and ask for an explanation. How come we're only getting $10? That's and get an explanation. So I just thought I'd share that those two things that we sometimes refer people to. And then I was going to ask James, do you know, are the community partner organizations yet allowed to help people with SNAP applications? That has been talked about for a long time. We've requested it for a long time because there are community organizations that are like, you know, people who speak Marshallese that are help people signing up for the Oregon Health Plan. It'd be really nice if those trusted community partners could also be helping people with SNAP applications in their own language. I don't know where that's at yet, at this point.
It's funny, I sent an email about that this morning. So right now we are we're developing rules for medical assisters, to also help with SNAP application. And so that's a limited subset of people, because I think most of the community partners here are not also medical assisters, for instance. But I don't have anything finalized right now, so I can't really say much in this topic other than we would love to have people assist in however they can with people's SNAP applications. And it is rather limited because, of course, you can't have access to the one system like a medical assister does with OHP. But right now, officially, there's only a limited amount of help a person can give someone else in person. So we're going to be looking for the actual federal code to see, what governs this, and I'll get back to you because I share your frustration right now. Yeah.
Feel free to say that that at least someone from the partners that you meet with is still requesting that, and there probably are other people on this call that would second that.
Yeah. And like I said, I also wanted to come back to the larger question about immigration in general. And Beth, I ran into one of your colleagues yesterday, Bridget, when I talked to her a little bit, and I'm thinking maybe, because there is also an OHA webinar where a lot of these questions are especially directed right now, that it could even, we could get the Oregon Law Center to prepare a guidance, because right now the messaging is tricky. We can say that, under current rules, you're fine, everything's hunky-dory, but we can't say what the rules may be in the future. And that, of course, is scary for people. And how do we message that so that potentially affected communities can feel confident in whatever it is they're doing? And that's something that we would look to Oregon Law Center and to all of you here on the call too, because you work with these communities and you know what messaging they would respond to, and we'd love to work with you to determine how to best convey that knowledge that, we don't keep that immigration status data in an obvious way, and we have rules that are going to say that we're not going to turn it over. But if a federal person comes along and knows the right questions to ask and knows how to dig through our system, then there's a possibility. It's just, it would take time. So it's not something that'll happen quickly. But that's a jumbled messaging. We need to figure out a better way to say it. And I'm rambling. Go ahead, Misha.
I just wanted to let you know that Chris Stratz has joined us from SNAP Policy to be able to answer any questions that might be coming up.
So Chris, just to catch you up, there was a question about the sliding scale of SNAP benefits, and if a COFA person has anything different than anyone else applying and being eligible for SNAP, and then why is it that some people only get $10 a month, things like that. How can they know if that's right and make sense? So just to throw you into the deep end of the pool there, Chris.
Well, I got my floaties on, so. Is the question just basically why overall individuals that receive SNAP get different amount of SNAP benefits? not just particularly COFA individuals, right? Are you just asking, or why in particularly all different types of people get different amounts? Is that the question?
Yeah, I think that's a fair way to put it. Linda, if you wanted to restate it, that'd be great too.
Sure. Hi, Chris. So my question was, it was from a community member, reached out to our office, and they were kind of concerned about their eligibility or their benefits after they've been qualified and eligible for SNAP. This is a Marshallese in the Marshallese community that we work with. They just had that question. So we weren't too sure. So we asked them to call that 800 number or the ODHS office, that they can speak to one of the reps there, because we have no knowledge of the questions on or answers to them. But so now that you're on line now, so it's just, I just want to make sure that this is something that you guys are going, ODHS going by a sliding scale, or is this like income based? Like how does this work? But by all means, I don't share that information just because we're not to give inaccurate information is what I say. And we just don't want to have that problem with our community and be upset and then don't reach out to ODHS, which they would probably be better to answer that. So
Yeah.
that was my question.
Okay, yeah, sure. I mean, really it's an income-based program, and it's based to supplement food for people with low income, and it is based on what income they have, also what type of deductions they may have. All of those play into the amount that they get for a monthly allotment for SNAP benefits. So depends on, again, how many people are in the house requesting benefits. So if there's, more people that are requesting and they don't meet that income threshold, then they may get more than somebody is just a single person that is applying for benefits with one income or no income. So it's based on solely based income based, and then we take in certain deductions that individuals qualify to that may play in a factor in that as well.
Perfect. Thanks for elaborating on that. And then I did have another question, but it just ran away. So on top of my head. So if I do get it back, I will ask you. It's regarding the under the COFA SNAP benefits and the Marshallese community. So thank you so much, Chris.
Yeah, sure. If you happen to remember the question, I'll just stay on the call and you can type it in the chat or answer it again when you
Perfect.
think
Thank you.
of it.
All right. Any other questions?
Oh wait, think I got my question. Sorry, James. I think I brought it. It came back. So this question is going to be for Chris again. So I also wanted to know, in the community, at the time when the bill did pass by the federal state or federal in Washington, D.C. back in March 2024. Once that was announced, so some of our communities went out to apply. Are they able to retro back to that application that did get denied, or is that something that it just happened to work with the state? It depends on when the states was implemented to ODHS.
Yeah, so when that bill passed on March 9th, there was a considerable amount of time that offices were waiting for our federal partners to give us guidance on how we were going to move forward with eligibility for those COFA individuals. We didn't receive that guidance until the mid part of July. And then there were certain factors that played into that, where if they had applied for benefits on March 9th or after, they could reapply, and then they could also request for a hearing. And if they requested for a hearing, then that could be retroed back to the benefits from when they applied after March 9th. And then others, obviously, when that time frame had passed and we had received the guidance, then when we received SNAP applications, we would process them and they were eligible if they met all other non-financial and financial criteria.
Perfect. Thank you so much, Chris.
You're welcome.
Thank you, Linda. I hope this new eligibility has been beneficial. We will check on that Marshallese application though. And Misha, I don't know if you want to open it up for broader discussion now, or do you want to go to the next item?
Well, I thought since Chris is here, not to put him on the spot, but for those folks who don't get the opportunity to attend the SNAP partner meeting very often, you've got Chris here. Anybody have any other SNAP related questions you'd like to ask while he's in this space? It's okay if you don't, but I wanted to make the offer. All right, I'm not seeing anything at this time. Thank you so much for coming out over to the meeting, Chris. Appreciate you making yourself available so quickly for us.
Yeah, absolutely.
So
Thanks.
yeah, thanks. Appreciate you. We do have an announcement to make, but I thought before we would do that, we can go ahead and open the floor for 10 minutes probably for any other announcements or information that you would like to share with the group. I do understand that there are some different things going on. Folks are getting information about budget. If there's anything that you would like to share or questions that you would like to just kind of speak into the space, I'll go ahead and hand the time over to anybody who would like to share.
Good afternoon. Can you hear me okay?
I hear you.
Okay, hi, my name is Ruby Graven, and I'm one of the regional outreach coordinators with the OHA Community Partner Outreach Program. And I was trying to get myself off mute, but I could not. So one of the questions I get from community partners about SNAP, I don't know if you still can answer this question, is if there's resource limits, because some of our medical programs have resource limits. I think some of the community organizations who are enrolling Oregonians in the Oregon Health Plan, that's a question that comes up, and I've never been able to answer that. And you might have already talked about that, but I just wanted to circle back.
No, I think it's a great question. Chris, are you still here? I see you. Your name listed anyway.
Yeah, I'm still here.
Yeah, thanks.
Most of our SNAP recipients that meet the categorical eligibility limit, which is 185% of the federal poverty level, they usually resources, they're not looked at for SNAP. So we don't, I guess when they're categorically eligible, it just means that their resources are not considered when we're determining eligibility. And because of that income threshold of 185%, if most of our applicants, that are eligible for the program meet that requirement, so therefore it's not something that we look at for SNAP.
Oh, okay. And I believe like resources would be considered a vehicle, for example, or like a bank account. Is that correct?
Yeah, correct. Vehicles, definitely not. And then bank accounts only come in to play if somebody is not categorically eligible and they may happen to be elderly. we might look at to make sure they meet the resource limit to see if they're still eligible to receive SNAP benefits, even though they're over the 185% of the federal poverty level.
Okay. Thank you for answering that question. And I do have an announcement to make, and that is just that some of the regional outreach coordinators are likely, probably I would say most of them, we have several regional outreach coordinators across the state like myself, are sharing information with community partners about young adults with special health care needs. So just that announcement that's going out, I don't know if anybody's already talked about this. I jumped in a little late. Is that starting January 1, the Oregon Health Plan will offer benefits to young adults with qualifying health conditions under new Medicaid eligibility category called Young Adults with Special Health Care Needs. And those new screening questions will appear in One Online as early as December 23rd. There are live community partner trainings, which are going to be held on Tuesday, December 17th, one in English and one in Spanish. And so we will be getting these communications out to our community partners. It's really just to prepare some of our OHP assisters with the program, understanding the program, everything from enrollment, what things look like. And the training for partners is not required. So if we have OHP assisters on the call today, the training is not required, but we do recommend anybody who is actively assisting Oregonians with enrolling in the Oregon Health Plan, you know, especially those of you who have active assister ID numbers, to go through the training really because there's going to be valuable information. And we know families look different, so not everybody is like a one-size-fits-all approach, and many times you're going to run across youth and younger people who may be eligible for the specific program. Thank you.
Thank you for that announcement. No, it has not been made, and it was a great announcement to make. Does anybody have any questions about that? All right, I appreciate you sharing. I see you're on phone. Do you have access to the meeting if I were to put my email in chat?
Yes, I will get that uploaded here in just a second.
Okay,
I can add the registration links. And
okay,
the
perfect.
announcement I made, I can put that in there here in just a moment.
Perfect. I was hoping that maybe you could, or email me if you have any flyers or any informationals on that we could get out with a follow-up. That would be wonderful.
Sounds good.
Thank you. Anybody else have something they'd like to ask or have an announcement? Zoe.
Hi, Misha. Hi, everybody. Thanks again for these meetings. Good to see you here. I have just a share out, which is that, so my name is Zoe Cooper Caroselli. I'm the program coordinator for the Basic Needs Oregon Benefits Navigators on college campuses across the state. And was quite dismayed this week to learn that the governor's recommended budget cuts the funding for our benefits navigator positions. Those positions will continue to be legislatively mandated and crucial in terms of connecting students to resources, especially for SNAP. So we are going to work our butts off in Salem to advocate that that not happen, as well as for additional funding. But I just wanted to share that in this space. I know some benefits navigators are on the call, and many of you may work with benefits navigators. Oh dear, my cat. Sorry. And just to know that that is part of the landscape that we're working in right now. Thanks so much.
Thank you, Zoe.
The benefit navigators have been a huge asset to our work, being ready to share information and take a look at potential resources that we have to share. So.
Thanks, James, and thanks for sharing, Zoe. I just learned about that myself yesterday, and I know we've had lots of the navigators join us in this space, and always really appreciate um, their thoughts and advocacy and their perspective and the barriers and the stories that they share, as they're working with folks. So it's so important, the work that y'all do. All right, does anybody else have anything that they would like to share or ask about before we do kind of a final announcement? All right, I am not seeing anything. So I do have an announcement for you all. So as you might recall, I entered my current role 2 years ago to fill in for James, who has been helping facilitate today as he transitioned into an opportunity with Oregon Eligibility Partnership. The position, it's a contracted position with an end date. And while the date has been extended multiple times, I have recently learned that it is coming to an end, which means that while I'll continue to be available because I still work for self-sufficiency, I will no longer be facilitating this particular meeting, as I will be returning to my former position, which is Community Partnership Coordinator. This is a regionally focused engagement position. So I will be working in that region, which is Lynn, Benton, and Lincoln counties, and focusing my work there. We have worked to update the partner welcome guide to help with this transition. So I'm going to put the link into chat here really quick. You've seen this guide before, but we have gone through a revision to make sure it is up to date as possible and that there are contacts for each of the programs, and would definitely encourage you to reference that if you have questions or needs. James will continue to support these meetings and will be facilitating in January. And you're welcome to reach out to him or to I, and we will definitely try to address whatever the need is and get you to the right person. So, just know I'm still around. I'm still here. I just won't be facilitating this particular meeting because my position will be more regionally focused. Because I will no longer be facilitating this meeting, um, I will need to delete, sorry for the dog barking in the background. I will need to delete the calendar invitations and the Zoom link that were sent earlier. These were made under my account and aren't accessible to others. And so the meeting's not canceled. It will continue at its regularly scheduled time, but it will have a different Zoom link. And so in an effort to avoid the invitation issue that we had last month and making the Zoom meeting accessible to multiple facilitators, we're going to send it in a new way. I just wanted to let you know about that. I felt really terrible about the many emails you all got from the last way that I sent the invitation out. So we're fixing that. So what I'm going to do is I'm going to email partners and explain the transition, because I know that not everybody is with us today. And in that email, I will also provide a registration link to the new 2025 Self-Sufficiency Partner Meeting series. I'm sure you've registered for Zoom meetings and conferences in the past, so this should work the same way. Once you register, you'll be able to download your personal Zoom calendar invite. So I just wanted to let you all know that what was happening, and just that I am honored to have been able to work with you these last 2 years. And I thank you for that time, and want to let you all know that you'll still see me around. In fact, you'll probably still see me in this space, because it's a great space to come to, and I will just join as an attendee and listen and learn with all of you. And so I look forward to continuing that space with you all. James, did you have anything that you wanted to add for partners?
Feels like you covered it really well, other than, this is something that we started that really was born the beginning of the pandemic, but and so I was just throwing spaghetti at the wall, see what worked. But Misha really organized it and made it into sort of James's little throw together project into a thing. So I really appreciate all her work that she did, and I think we'll all be a little bummed that she won't be in this role. So
Thanks, James. Appreciate it. And those of you who have put messages in the chat, I appreciate y'all too. So be on the lookout for that email that will give you the new link because you'll want to register so that you can download the invite to your calendar. And we have a silent support that you may not all know. Her name is Mackenzie, and she is the admin for this meeting. You might hear from Mackenzie in the future. So look for an email from Mackenzie Yarnell as she'll probably start taking on more of sending out some of the information that goes to y'all. For example, the agenda. And when the agenda is sent out, it will also kind of restate that link. So if you lose it for some reason, it will come out with the agenda as well, so that you can. It's you. She's chatting in the chat there. So you'll have a reminder of that link in case you lose it at some point in time. That will come out. So as long as you are a member of our self-sufficiency partner listserv, you should get this information. That'll be sent out in the next week. If you're not a member, please put your email in the chat and I will make sure to add you so that you don't miss out on any of that communication. So thank you all. I've enjoyed working with you and look forward to what the future brings. I hope you all have a great rest of your week and rest of the month. Thanks for being here today.